students that want to work at the intersection of population, health and place. So health, you can speak very broadly about, so you might say human well-being in all its guises. The spatial piece is, to some extent, the reality that everything happens somewhere, sometime. And what we find is that a person's life prospects vary by where they're born, where they live their life, where they choose to live their life, what occupation they choose, etc., etc. And some of those decisions are place-bound. You know, a really good example would be a few years ago, there was a young woman that got a Ph.D. in environmental health in the Keck School of Medicine, and the group that Rima is affiliated with, that then came here as a postdoc. She only spent 6 or 7 months as a postdoc, because then she had this fabulous opportunity to go to the Centers for Disease Control and to be the lead in developing life expectancies at birth estimates for the 3,000 plus census tracts in the United States. First time anybody's ever attempted to do that, but the miraculous thing was, the census tract with the lowest life expectancy at birth was in the state of Mississippi. The highest one was in the state of Washington. The life expectancy in the lowest one was 55 years at birth, all right? But in Washington, in the highest one, it was 97. So there's 42 years of life that on average was acquired by those lucky enough to be born in that census tract in Washington relative to the people that were born in Mississippi. We know nothing else about their life trajectory, whether they moved, how often they moved, but I would simply say on that same sort of equity question that we can find plenty of places in the world where 42 would be aspirational in terms of life expectancy. Parts of sub-Saharan Africa and other parts of the world now too. So that's the place there. So I've talked about the spatial piece, I've talked about the health piece. The population piece is that certain groups of people have certain characteristics that lead to certain outcomes. But probably when the program was created, we were more thinking about what happens through the life course, and when things happen may have tremendous implications for the lived experience and how long or good that lived experience is. So that's the main angle here. So next. So what's happened to my pages? What has happened? Oh, I see. Sorry. So Spatial Sciences was established. I'm the founding director in July 1st, 2010, so we're about 13 years old. We have 13 full-time faculty, interdisciplinary faculty. We have 44 faculty affiliates, 8 full-time staff. We're sitting in the conference room right now, or at least Rima and I are, and Daniel's on Zoom. And, you know, we're in the center of the University Park campus. We have faculty, staff offices, some research space, as well as some state-of-the-art teaching facilities. We run 18 academic programs. We have substantial research enterprise and a large shared computing infrastructure that everybody affiliated with spatial sciences has access to. And more importantly here, spatial sciences is an administrative home of the Population Health and Place Ph.D. program. So next, I think it's your turn, Rima.
That's me?
Yep.
Oh,
Isn't
sorry,
that you?
I did not realize that. I thought I was slide 14, but that's okay. So again, hi everyone, I'm Rima Habre, hoping you can hear me okay. I'm an associate professor in environmental health and in spatial sciences. I'll be telling you a little bit about our Department of Population and Public Health Sciences, which used to be called Preventive Medicine. It was founded in 1978. The department is very large. It's almost at the scale of the School of Public Health in terms of size. It has over 100 faculty and 6 divisions. One of these is bioinformatics. Then there's biostatistics, and I'll tell you a bit more about sort of different areas of research and instruction in these different divisions. There's disease prevention, policy, and global health, so thinking more globally in terms of human rights issues, sustainable development, etc. Environmental health, that's where I'm based. Epidemiology and genetics, we have some, very sort of established faculty who have invented some of these methods actually for genetics that have really pushed the field forward. And we have health behavior research. The department itself is unique in that, on top of the teaching enterprise, it really has a very big research portfolio. It ranks as number 2 in terms of NIH funding nationally. So again, even though it's a department, it's very much akin to being in a school of public health, and it's a very large enterprise. We're located in what we call the Soda Street building, which is close to the hospitals area and the medical area of the health sciences campus, and that's connected from this main campus by a USC shuttle. So a lot of our students are actually back and forth a lot. Thanks.
Okay, and my notes, Daniel, it says that you'll handle this slide. Are you comfortable, or do you want me to do it?
I can give it a shot, and then please add anything that I omit. So in terms of the more on the sort of population and place side, there's a lot of faculty from multiple schools, really, and I think that speaks to really the exciting opportunities for training, kind of incorporating a number of interdisciplinary or disciplinary perspectives, and really focused on topics such as culture, demography, families, gender, immigration, labor, race, ethnicity, religion. I would probably include, neighborhoods and neighborhood factors, general stratification processes, and then, of course, eventually how that intersects as well with health. Faculty come from the Department of Sociology, the school where I come from, the Suzanne Dorick Peck School of Social Work, the Leonard Davis School of Gerontology, as well as the Department of Population and Public Health Sciences. And again, I think this even speaks to, if we think about the type of scales that I think you were hearing earlier, and thinking about scales from a spatial perspective or scales from a temporal perspective in terms of thinking about life course development, you'll see a lot of those themes across the schools that are represented in the faculty and faculty research areas. And then later on, I can share a little bit about the research that I do as an example, as just one example of them.
Thank you. Next, Brandon. Okay, so apparently the next 6 slides are pretty boring, but they have a large and important message, I think, that's built around them. So both in the Spatial Sciences Institute generally, and also in the context specifically of the population, health and place faculty, our strategy has been to build a big tent, and if people knock on the side of the tent and say they want to come in, then invite them in. If there's people out in the university community that we think could embellish what we're trying to accomplish, then we might reach out to them and invite them in. And in these tents, one for population health and place, and one that maybe is 80% similar for the institute as a whole and all its academic programs. The only rule is that you've got to be nice, right? If you're not nice, then apparently my job is to ask you to not participate. That has not happened yet, and so we try to create opportunities for faculty and students to collaborate in ways that are win-win, so that the faculty member gets something from the collaboration and the student does as well. And just this first page here, Paul Adler is actually from the Marshall School of Business. Jennifer Elshire is from the School of Gerontology. Lourdes Bezaconde is from Population and Public Health Sciences at Keck. Tracy as well. Timothy Bublaz is the chair of Sociology. Joan Bloshnik is from the Keck School as well, as is Ricky Blumenthal and Carrie Breton. So next. And on these slides, you can see that they cover a whole variety of different domains, different methodologies, different approaches they have for doing science, working, and in many ways they already work at this intersection between population, health, and place. But in most cases, if they don't do that, they want to, and they see the students in the population, health, and place PhD program as a conduit, a beacon that can take them to that place. And so this is part of this important win-win-win. This group here includes Miles Coburn, who's very accomplished cancer epidemiologist, as well as an accomplished spatial scientist. Kayla Delahaye works a lot with several students now in the program. Juan Delara comes from the Department of American Studies and Ethnicity, I think, in Dorset College. And so again, there's a great breadth. We're not worried about where people come from. It's whether they have an interest and they have the capacity to contribute to the breadth and depth of the PhD program. So next. Super aspirational list of scholars here, including Daniel and Rima, and Frank and Sophia are very senior faculty within population and public health sciences. Jill is very accomplished and focused on environmental health and equity. Li Wai Lu is a key faculty and administrator within the Norris Cancer Centre, and Laura is an accomplished geospatial scientist in the group here at Spatial Sciences. Next. Similar thing here, I think. Maybe the highlight on this list is Manuel Pastor, who's a university professor, founding director of the Equity Research Institute here in Dorset College. Super aspirational scholar, but so are most of the other people on this list. Next. More here, including Professor Swift, who teaches the spatial computing class. Very accomplished and senior scholar here in spatial sciences as well. The person after on this list, Jonathan Tan, is actually interested in pediatric health systems, electronic health records, and his daytime job is a practicing physician in Children's Hospital, Los Angeles. And Stephen Sanko at the top there works for LA County in the emergency medicine team, as well as holding a faculty appointment in Keck. Darren Riddell's in the room as well. He's the Director of Graduate Studies within Spatial Sciences here. Accomplished scholar and a busy man, because we have maybe 10 or 12 graduate programs that he oversees. Next, please. And then last, the list that includes me, several of my colleagues here in spatial sciences, and 2 more colleagues from population and public health sciences on the Keck campus. Next.
I think this is me.
Yep.
Okay, so I'm also excited to tell you about some of the research opportunities in several of the big research centers we have over in population and public health sciences. I will say this is not a fully inclusive list. There's more, but these are some of the big groups and research studies going on. So for example, the first one you see here, the Madre Center for Environmental Health Disparities. I actually work within this center. I'm the Director of Exposure Assessment, and I lead a specific project within it. This center is looking at environmental health disparities in low-income pregnant women in Los Angeles. So we look at how things like air pollution and the built environment and the natural environment and chemical exposures affect pregnant women's health and their babies' health. The Institute on Inequalities in Global Health is led by Dr. Sophia Graskin and by Dr. Laura Ferguson, both affiliated with Spatial Sciences. And this institute does a lot of very interesting work at a very global level. So looking at human rights issues, sustainable development, population mobility, kind of legal aspects of health inequalities and how to make a dent in inequalities. We also have the Southern California Environmental Health Sciences Center, which is also where I'm based, and Dr. Wilson and I actually co-direct the exposure sciences research program in that center, and a specific core that's meant to sort of, educate and train and help scientists understand how to better characterize the environment if they're interested in looking at different health aspects. We have what we call the CTSI, or the Clinical and Translational Science Institute. This group has a lot of bioinformatics expertise and computing expertise, and they've been developing important sort of data systems on top of the entire health systems, electronic medical records, to enable sort of really cutting edge research looking at various aspects of healthcare delivery, health inequities, environmental health, and again, working with Dr. Wilson on these issues. We have the Center for Chronic Health Disparities in Latino Children and Families. This is a center led by Dr. Michael Gorin, I believe. And the focus here is really understanding sort of disparities and inequities affecting the health of Latino families, mostly around obesity and metabolic disease, things like non-alcoholic fatty liver disease, growth patterns, and sort of these disproportionate impacts that are very specific to the Latino community in LA. And last but not least, of course, we have the School of Gerontology, which looks at aging diseases and sort of lifespan aspects of factors that sort of facilitate, aging gracefully, or risk factors as people get older in terms of, biological markers, or Alzheimer's disease or brain disease or things like that. So it's a very wide list of opportunities here, and I encourage you all to sort of look up the websites if you want to learn more, or reach out to me or to Daniel or to any one of us here to find out more. But this is a good overview of some of the research going on over in population and public health sciences with spatial sciences. Thank you. I think that's Daniel.
Next, Daniel, Brendan. Daniel.
Excellent. Well, what I thought I could do is share just a little bit about some of the research that we do with my team, just as an example of the kind of program that's a research program that's connected with this program. And from a big picture perspective, the work that I do focuses on the developmental origins of disparities in health and well-being. When we think about children and adolescents growing up, one of the ways we think about that, which is related to thinking about social determinants of health, is how children and adolescents are nested in proximal environments, like their family relationships with parents, with peers, that are nested in larger kind of environments or exposures. Could be school environments, social media, service environments, air pollution exposure, that are also nested in kind of broader economic systems, thinking about culture, time and history, politics, systemic racism. And that's kind of the framework in which we think of our work. And in that kind of framework, we're interested in the role of adverse experiences, such as poverty or maltreatment, when it comes to life course development. So thinking about how differences in development or health and well-being, or kind of early indicators of later health, emerge over time, and sort of the intersection of childhood experiences and exposures, as well as later experience and exposures. And a particular variant of that is related to the intersection of COVID-19 stressors with kind of prior childhood experiences. And we focus on the social and psychobiological mechanisms that would help understand how these exposures might relate to physical and mental health downstream. So we take a multi-level perspective, not only thinking about contexts such as neighborhoods, as well as the contextual protective factors, the aspects of our environment that support children and help children thrive and do well, as well as kind of biobehavioral systems, thinking about brain development, epigenetics, stress response systems, and more. You can go to the next slide. And to just give a couple examples of sort of projects then related to that perspective, we have one ongoing project related to neighborhood disadvantage and neurodevelopment. We're particularly interested also in the role of COVID-19 in school closures, as well as protective factors at the family, school, and community level. And with this, we're using data from the Adolescent Brain and Cognitive Development Study, which is really exciting, large-scale national study of child and adolescent development. We have another project which kind of goes from the population into the lab, thinking about using virtual reality models of different neighborhood conditions to understand how adolescents respond. We have some other work focused on the role of child maltreatment in the development of mental health and epigenetic change and epigenetic aging as possible mechanisms that help us understand that relationship. And I wanted to highlight just one kind of area that I work on with a student in the PhD program focused on understanding kind of vulnerability or predictors of autism, vulnerability to the development of autism, and looking at the role of air pollution exposure as well as neighborhood characteristics. So I think that's the brief snapshot. And as Rima said, I'm delighted to talk with you more. Please feel free to reach out to me directly with any questions that you have. And before we get into the rest, I also just wanted to highlight as a sidebar how enthusiastic I am about this program and about the experiences and the training that it provides. And so excited to see all of you here in this session.
Thank you, Daniel. So next, Brendan. So the number of classes you have to take as a PhD student at USC is partly related to whether or not you come with a master's degree or not. So if you don't come with a master's degree, you came straight from an undergraduate degree, it means you've got a super academic record for one, but practically it means in terms of this that you're probably going to have to take more classes to accumulate the number of credits you have in order to be eligible to take the qualifying exam and to prepare and defend a thesis dissertation proposal. If you have a master's, then you get to count certain numbers of credits with our approval towards the total, which I think is 60 for the student to get to the qualifying exam in later stages. And so we've really built a program with as lean a core as we think is appropriate. And so here, you would start this program with a class called the Geography of Life and Death, super aspirational title. It's modeled after a famous book that was published, I think, in the 1930s and 1940s by Dudley Stamp. And then in each of the first 2 summers, you take a practicum around population, health and place research. The first summer, you try your hand at writing either a review or an empirical paper. And then the second summer, you try to complete a complete draft of a PhD dissertation proposal. The upside to those 2 things happening those 2 summers is that we fund you for those summers. And then the original idea was there were 3 classes that were sort of around the health piece, 3 classes around maybe what we call the population piece, and 3 classes around the spatial piece. And you'll see that in the middle there's just 2 sociology classes, both about demography. Originally, we had ideas of using their advanced quantitative methods class, but for various reasons, we didn't think in the end it was optimal, and so we've now developed and are really teaching seriously for the first time an advanced quantitative methods class for population, health and place. It has a particular niche because it sits between a bunch of classes that talk about concepts of spatial thinking and how to implement those. So that's on the right side of this table here. And then on the left side, you'll see, among other things, a class about the principles of biostatistics. And so what we're trying to do is to build 3 classes that touch 3 aspects of thinking quantitatively about the intersection of population, health and place. And then below that, you see the opportunities for independent research, which might be a function of your ambitions or your prior training. And then there's a long sequence in which you're just a PhD candidate working on your dissertation. Next. And for those that either wanted more training or need more training because they came from an undergraduate program, there's a lot of electives. There's a lot of electives across other schools like gerontology and social work. There are a lot of electives in sociology and in spatial sciences and in population and public health sciences, which still uses PM, preventive medicine, as its prefix for its class codes. Next. So maybe I could use this slide to tell you a little bit about the character of the program. We are looking for we're looking for men and women who believe that a Ph.D. would elevate their chances of becoming a leader. So that becoming a leader could be that you anticipate playing a prominent role within a private sector company that provides services to clients around health and human well-being, and thinking about that broadly in relation to urban design, planning, stage of life, etc. It could be that you're thinking about maybe a job in the academy as a professor or something like that, or just as likely it could be you thinking about a job in the federal government or the state government or in county government, where nowadays there are typically large departments that are focused on how do we build environments that support good health and prosperous lives. Now, all of those in our minds are worthy outcomes. Which one suits you is maybe a question of where your interests are, and maybe even your character, in the sense that I can just speak for somebody that went to university and has never left. The seeing that you made a difference in the world as a faculty member takes a long, long time, because even though I'm expected to write a lot of papers, I can tell you that generally not many people read them. And so that's not how I'm going to make an impact in the world. The impact I make in the world is the young men and women that I train, and my success is their success, right? And so if I can elevate what they want to do in life and then prepare them so they can go and do that successfully, that's really job number one if you want to be an academic. I've long realised that if I'd gone into, say, consulting as a spatial scientist, I could have had an immediate impact, because maybe I would be building analytics and so forth to support making data-driven decisions around urban design, around healthcare management, anything that you can think of, right? And so you could do that in, for example, the Los Angeles County Department of Public Health. You could probably do it within Los Angeles County Department of Parks and Recreation, or in planning, or et cetera, et cetera. And you could just as easily do it as well in, say, the National Cancer Institute or any of the other NIH institutes, or the Centers for Disease Control, right? And so there's just we're not looking just at training people to become replacements for us. We are thinking very broadly about that. Another thing we're thinking very broadly about is that we've been very purposeful and careful in organising the admissions committee for all 8 cohorts that we've so far recruited. And so the directions from me to the admissions committee is find the people that you think have the best potential to become leaders at this intersection upon earning a PhD. We're not trying to match up you with a faculty member that already has funding so that you can work on their research project. If that's what you end up doing, that's fine, but we will encourage you to think that that's the topic you want to work on, rather than simply the topic that somebody else already has and they want to fund you, right? There are ways to be funded in this program without you signing up sight unseen to work with somebody that you've never met. It seems to me that's a travesty, and so we don't need to do that. So what we offer is 5-year. When we make people an offer, we are obligated to provide 5 years of funding. 2 of those 5 years will come from some form of fellowship, and the other 3 years could be either a graduate research assistantship or a graduate teaching assistantship. I can tell you in spatial sciences that typically we need anywhere from 8 to 12 graduate teaching assistants every semester. And right now I'm looking at only having 3 in spring semester, because the people in this program turn out to be in high demand as graduate research assistants across spatial sciences and the rest of the university. So it's that's one of those good problems to have, I guess. So I've covered funding. I think I've covered the admissions criteria. If you apply as part of your application, you're welcome to specify the examples of people you're interested in meeting and perhaps working with, but that's non-binding. And in general, I will advise the admissions committee not to place any value on that. I understand it's valuable to you, and it's to some extent valuable to us just to know where people might fall out, but it does not influence the recruitment decision. We are trying to identify leaders, and so 2 people come from the cluster of faculty in the population group, 2 people from the health group, and 2 people from the spatial group. And the miraculous thing is that the last 3 years, they've all chosen the top 10 candidates. Typically, we have anywhere from 35 to 40 complete applications, and typically the committee advised me to make more offers than I have funds for. And so generally our aim every year is to recruit at least 3 and possibly 4 or 5 PhD students. So it is competitive, and so the onus for all of you is to cast your application in the best light possible. And then we've talked about careers, and so you know, it's an interdisciplinary program, and so we've got various structures built within it to ensure that. One is that every student has 2 co-advisors, and those 2 co-advisors have to come from 2 of the 3 domains. So it could be population and health, or it could be spatial and health, or it could be spatial and population. I think we probably have examples now of students that are in all 3 of those combinations. So next, Brandon. So just quickly, there's some students sitting here that we might ask to introduce themselves in a second, but here's 2 recent graduates. So Avery Everhart earned a PhD in 2022, and her topic was incomplete data and insufficient methods, transgender population health research in the US. I think Laura Ferguson and I were the co-advisors, and she's now a tenure-track assistant professor of GIS cartography and transformation in the Department of Geography at the University of British Columbia. That's an aspirational placement for us, because if you look at the world university rankings, I think University of British Columbia is around number 35 in the world, or thereabouts, and the University of Southern California, I think, is 114. And then the young man below that, Lee Yi, also earned his PhD in 2022. Rima and I were his co-advisors. So we couldn't persuade him to pick a short title. So investigating daily effects of activity space-based built environment exposures on physical activity, behaviours in a Hispanic woman during pregnancy and early postpartum. I'm tired now. I'm also a journal editor, and generally I tell authors their title needs to be 12 words or less. And he's now a 2nd year postdoctoral research fellow in the Department of Medicine at the Harvard Medical School and Harvard Pilgrim Healthcare Institute. I've heard that Harvard's an aspirational school as well. Next. And then 2 people that graduated in 2021, Joanna Avila, her PhD topic, LA homeless community, water, sanitation and hygiene and security. So it gives you a good sense of the breadth now. I think Steve Senko and who was the other advisor? I can't remember.
I can't remember either.
But in any case, Yayi Chang, who's left us for a job as associate professor in the school in the Department of Computing at Computer Science at the University of Minnesota, and Steve Sanko is part of the Department of Emergency Medicine in the Keck School, and has a day job as a emergency physician, I think, in LA County Department of Emergency Medicine. And she's a postdoctoral fellow scholar at the University of California, San Francisco. And then Douglas Fleming, who's our first graduate. His topic was spatiotemporal analysis of out-of-hospital cardiac arrests and bystander CPR in Los Angeles. And he's a GIS project coordinator, Center for Disease Control Geospatial Research Analysis and Services Program, and based in Atlanta in Georgia. So next. And then I'll start at the bottom, Beta Minaravish, 2022, Transgenerational Impacts of Environmental Inequities on Children's Development. Super proud of both these individuals because they finished their PhD in 4 years. And she's currently an equity data postdoctoral scholar in the Equity Research Institute at USC with Manuel Pastor. Darren Riddell was co-advisor with
Jennifer Unger.
Jennifer Unger in Department of Population and Public Health Sciences. And Beta will be joining us as a faculty member in January, once I write the letter offering it the position. And then Michelle Livings is our most recent graduate. Her dissertation topic was contextual influences on adolescent mental health.
Another no-name place here.
And she's gone to another apparently aspirational place, Princeton University. She's gone to the group that managed the production of data and the preservation of data for a big cohort study that the NIH has funded now for many years. And so she was super excited. She was lucky that they had a position open when she was planning to graduate, and she, I think, sped to the 4-year mark knowing that was going to happen, and was lucky enough to win that position. And
no pressure.
and she, I know her very well because for 2 years she was a graduate research assistant working with Kayla Delahaye and myself and Wally Bruin de Bruin. And none of us had anything to do with her PhD and the publications that have been generated along that thread. But I think she's been lead author or second author for 4 refereed journal articles around food and nutrition insecurity as well. And so here's an example of a young woman that you know, saw opportunities and then seized them and is trying to use those now to set up the next phase of her career going forward. So next. And then some of our PhD students and candidates. You can see here that generally we have sort of a steady state population of about 20 or 22, 23 students now. Jacob Gazamba is a second year PhD student, so he's busy, I think, working to identify his 2 co-advisors. Han Chen is a PhD candidate. She is working with Robert Voss and
Li Hao.
Lou, and Norris Cancer Center. Jeffrey Roselle is working with disease burden and inequities with Bob Voss and...
I'm not sure I know Bob.
Okay, but Darren and I can't remember that. Erica Ho is a second year PhD student. She's interested in water, sanitation and hygiene access. Shinji Lee is working on light and air pollution impacts and is working with CC Wang and Lu Zhang in population and public health sciences. And Ishkar Relo is interested in food systems access, and he's a Fulbright scholar from Mexico. Jacob Gazamba came to us from Uganda by way of South Africa, and Xinjin Li came from China, and Han Shen did as well. So we have students from all over the world. You can see just from this little vignette here that they have widely different interests, but hopefully you can see that in one way or another they all can live very successfully at that intersection of population, health and place. And you know, many of these students are aspirational, so I know firsthand that Jeffrey and Jacob, for example, have already published refereed journal articles based just on the work they did before they became PhD candidates. Next, please, Brandon. Okay, so questions? The person listed on here, Darren Riddell, as I said, is Director of Graduate Studies. His email is there. And as well as Rima and Daniel and myself, he can help answer any questions anybody might have, either now or that come to you later that you write to us about. I think that's the closed. We could take questions if you'd like. There's 2 people here in person, and we think there's maybe another 13 or so online. So
18, it looks like.
18.
But maybe not all of the students.
So we're happy to try and answer any and all questions. There's a question from Madison about the application process. So, you know, the university has a standard application process. I think there's a December 1 deadline. So you need transcripts, you need, most important, to describe, you know, sort of tell a story about yourself. How did you get to where you are now? What are you doing? Why do you want to do a PhD? What kind of PhD do you want to do? And more importantly, were you given the opportunity to do that? What do you need to do? What do you want to do after you graduate? Because that might weigh quite heavily in the decision.
Your applications are not considered complete until the university has received all your transcripts. So
Yes.
hustle in your transcripts. I would say that's the #1 thing that holds up applications from being complete.
Dulcie, you have your hand up.
I do. Would you say this program is aimed at individuals who are also working, or is it just for students, graduate students that are not working?
Generally, I think the assumption the university has and that we are obligated to follow is that students in this program for the 5 years would be full-time. With one caveat, which is that 2 students currently, for various reasons, mostly good, are still PhD students in their 6th year, and they are self-funding, which likely means they are employed in order to pay the tuition and to support themselves while they are finishing their dissertation. There's another question here from Katrina. Do you need to identify and contact a potential advisor prior to applying? No. You know, I mean, when 40 years ago, when I was in this boat, I was assigned an advisor, and then after about 6 weeks, I made a lunch date with him in which I told him he wasn't my advisor anymore. That caused me many weeks of problems, in part because the university had a requirement that every student always had an advisor, and I dumped him before I actually had lined up a new one. So we don't have that expectation. If this is the kind of program that you want to be in, you're welcome to tell us who you might think would be the faculty candidates. You don't have to. We're going to look at your record, your aspirations, and then I'm going to ask the committee to identify the people who could go the furthest, fastest. And it's not really they've done that, it's the potential they could do that, right? And so we go from there. Sorry?
Kavya's
Yep.
hand is up, I think. Kavya, go ahead.
Yes, thank you. Thank you so much for this session as well. This is a very interesting program, and I look forward to submitting my application later in the year. My question was if there's a basic level of quantitative and spatial analysis skills that you expect candidates to come in with?
No. And same for the other two domains too. And let's say somebody came in and they had a master's degree in something spatial. Then what we would ask them to do is have a conversation with us, and they might not take one or more of the classes that were on that list I showed you, and instead they might take some other spatial classes that would accelerate the growth in their knowledge in that domain. And similarly, I know on the population and public health sciences side, some people come with a master's in public health, so they've likely already done 1 or 2 classes in biostatistics. So they wouldn't start at the A version of biostatistics, they may go straight to the C version or something else. So we're quite flexible that way, but we do want everybody to have some minimum level of training in all 3 of the domains.
Thank you.
I believe Nulu in the chat said she would like to ask a question but cannot raise her hand.
Okay.
Nulu, do you want to go ahead? There she is.
Okay, thank you. This is Nulu from Uganda. Thank you so much for the wonderful information from the presentation you just made. So my background is in population sciences. I have an undergraduate degree in population studies and a master's in population and reproductive health. And I've done research around issues of public health that's around contraceptive utilization, health and living conditions of persons with disabilities in sub-Saharan Africa. But from the presentation that you just made, I do realize that this program to me sounds like a well-balanced 3-legged stool of population, health, and place. So my question is, are you looking for students who have either, let's say, academic background or experience in all the 3 aspects of the program, or is it okay, for example, from someone coming from my, let's say, background where I have academic background is in more skewed to demography. My research experience is around public health, but I'm also interested in the spatial perspective, adding on to that to what I already have in terms of like applying that to my research interests, understanding variations within, these different topics among, these different kinds of people that I'm interested in researching on. That's one of the questions. The other question is, I did see that from the information on the website that we are required to submit a GRE or English proficiency test. What happens to someone like me who has done both their undergraduate degree and a master's degree from an English-speaking institution? The medium of instruction has been English, despite the fact that it's from Uganda, which is East Africa. Am I still required to do an English proficiency test? And then the GRE test, are there allowances to submit this beyond the December 1st deadline, or are there instances where this is exempted? Thank you. Sorry for being detailed.
Okay, I'll answer the first question first, because it's the easiest for me to answer at least, which is we're looking for people that aspire to be leaders. And in all our academic programs, including this PhD program, people come with different backgrounds, different aspirations, different interests. And what we try to do is help them, guide them through a set of courses where they have every chance to be successful. And so it's quite common for people to come with much more substantial training in one of these three legs of the stool than maybe the other two, and in some cases they may not have any formal training in one of those legs. So I think a person with your background would be just fine. The GRE?
So I think Darren would probably be the best person to help with both that and the TOEFL requirements.
Yeah. Darren, could you address those?
Yes, so Nulu, I'm gonna go ahead and I was just about to hit send on the chat. For you to take a look at the website that has the information regarding the English proficiency requirement for international status students. In there, you'll find that there's you can sort it by country, and it will tell you the requirements for your country. So take a look at that. That's standard for any applicant to the university. And then regarding the GRE, it is required for the program. And unfortunately, we don't have the ability to waive it for an individual. And yes, the deadline is December 1st. So you would need to have it in order for your application to be considered complete and included in the review.
Thank you.
Seems to be a few questions about having a master's degree as a kind of requirement or prerequisite.
No, it's not. I don't think it's a negative. Angela, you don't have a master's, do you?
No.
So we have one young lady that just joined the program here this year in August, and I was sure she didn't have a master's, and she's just confirmed this. And this is quite common now in top PhD programs, certainly across the United States. I don't know about the whole world, but quite a few aspirational students go straight from an undergraduate degree to a PhD.
I don't think Aviva had one either, right?
Yeah, she did.
Right. So, you know, we've already identified, just sitting here, Rima and I, that two students we've talked to today came directly from an undergraduate program. Yes.
Yeah, so because we just talked about that, it is at least a 5 years program, right? So for me, I'm now working in a transnational pharmaceutical company in China. So it's unavoidable for me to quit the job. So I'd like to know the fellowship could cover basic life expense, because in these days I stay in Los Angeles. I thought that, you know, the price is going high, you know.
Yeah, good question. So this year, the academic stipend for, say, a fellowship, if you're in one of those two fellowships, typically the fellowship years are year 1 and year 5. And, you know, some negotiations required if one wanted to change the year 5 to year 4. An example of why you might want to do that is that maybe your PhD requires some field work. So you couldn't be a graduate teaching assistant or a graduate research assistant, so you want to swap 5 for 4, and generally that can be worked out, but it takes some advanced planning. Currently, the academic year stipend is $35,700. This year, the amount was 5% higher than the previous year. And as I said, in those first 2 years, we will top that up with something a little bit shy of $12,000 for the students that joined us this year. So the first 2 years, they will have sort of a minimum of $47,500 or something like that. What happens in the future is not completely clear, because right now the university is negotiating with a union that the graduate student body voted to enlist as their representatives on a comprehensive contract that would lay out the specifications for compensation and work-life balance and so forth going forward. All of that's above my pay grade. Nobody's asked me or consulted me about any of that, but we anticipate that starting next year, we would be under that kind of framework. And that would be, I think, university-wide.
How do you finish in 4 years?
Well, I was.
You work very hard.
You worked very hard.
I was at a sustainability meeting last week. Rima was there too, and they went alphabetically through 1-minute introductions. Now, my problem was twofold. I'm last, 30 people have already done it. And second, I knew everybody but one person in the room. So why did I need to introduce myself? And so I said a few remarks about my research, and then I said, if you want to get to know me, just know that I get up early, work like hell, have a glass of wine and go to bed. That might be the
So just
recipe.
accepted, it's a minimum 5 years.
So that might be why you could do it in 4 years.
Glass of wine, got it.
The director said.
But what I would say is another way to answer that question is that the two young ladies that did finish in 4 years, one characteristic they share is they were very purposeful in what they did, and they were very good at keeping themselves organized and working towards that purpose. And you know, that's a real mark of their both work ethic and their ability to choose their goal and sail towards it continuously. So it's
And they did it without drama.
yeah, no drama, right? In general, I would say, because we've only graduated 3 cohorts, most people have actually graduated in 5 years, and there's so far 1 and soon to be probably 3 that have taken 6 years, and they just offset the 2 that took 4 years.
In part because of COVID.
Yes, and remember that almost all the cohorts that have graduated so far were somehow impacted by COVID. Right.
Thank you.
There was a question that went by, but we didn't see
It
all
was
of
too
it.
quick and it's hard to
And
figure
we're
out
gonna
what
have
it
to end
was.
in a bit.
Yep. Is there any more questions?
There was one that came in, but we couldn't see all of it.
I think it was, I'm guessing it was about the impression that you need a lot of quantitative skills
Oh, okay.
to be accepted into the program. Is that true?
No, you don't. So you're going to learn some in the program because not all, but a lot of spatial in one way or another is quantitative. But to Daniel's point, a lot of his work is around behaviours, perceptions, and so there are ways to take qualitative data and make sense of it and summaries and synthesis and so forth. And you know, we have one young woman that's working on suicide and is embedded in a community while she's collecting data about people and their attitudes and so forth. And so there are probably modest quantitative elements to that work. But much of it, I think, will be qualitative. Daniel, maybe you could weigh in there if you wanted.
I don't think I necessarily have anything to add in terms of the quantitative, qualitative distinction, although and I think the point that there's such a wide variety of methods, you know, approaches, even within quantitative methods, you know, the kind of overall approach with the foundational skills. So yeah, but I don't have anything particular to add to the quantitative, qualitative discussion.
The other thing to say, I think what I've learned about life is you have to be successful, you have to be a good storyteller. And there's nothing quantitative about telling a good story.
Yes.
So it may or may not be. It may be useful, but if that's all you can do, then you'll probably be disappointed that you don't have more impact. Okay. Any last call for questions? Okay, I think what we'd like to do is to thank you for your time and listening to us. And if you have any more questions, you could write to Darren or myself or Rima or Daniel. And we would welcome we welcome you for joining us today, and we would welcome your questions and none should be too hard. Just send them to us and we'll try our best to answer them. And we look forward, if this program fits your expectations and